Hello, and welcome to my office. My name is Dr. Calliope, and I'm going to be performing your head and neck assessment. How you doing today? Okay. I hope by the time you leave this assessment, you feel even just the littlest bit better. Now, let's get some quick paperwork out of the way. Alright, would you mind just confirming your name and date of birth for me? Okay. Good. And is that your preferred name, and how do you like to be addressed? Okay, very good. And just a real quick question. Are you in any current pain or have any current illness at all? Okay. Good. Now, let me just go ahead and take a look real quick. Your medical history. Is there anything new that we have to add to your medical history, to your family history, allergies, medications? No? Okay, very good. That's good to hear. Alright, so our head and neck assessment today is going to involve me feeling around your head, of course, your scalp. I'll be looking at your eyes, your nose, your mouth, inside your mouth, your throat, your ears, your neck, and just above your chest area, your clavicle area, a little bit with your shoulders as well. But pretty much from the chest up is what we're going to be focusing on today, okay? For the nature of this examination, I'm going to be popping on a pair of gloves, okay? Is that all right with you? Okay. And for this examination, I am going to need to be touching you. Is that okay with you? Do I have your permission to do that? Great. That's lovely. I'm going to put on our gloves. It's a bit warm in the office today, isn't it? We are finally starting to see some nice days ahead. It's been a long, particularly treacherous winter, but it all eventually fades away. At least in Iowa, it fades away for about 5 months, right? Okay, so to begin, I like to do a little general inspection, a little look at your head and neck, okay? I'm just going to step back a bit, or sit back rather, and I like to look at your skin color, if it is warm, if there are any inconsistencies. I like to look for any twitching, any involuntary movements. I like to look at your proportions. So is your nose in the midline? Are your ears at the same level on the sides of your head here? Are your eyes just about equal apart? Is everything in relative proportion and relative symmetry. I'm just noting if there is anything else that I may need to have a closer look at or note down. Just taking a little look. Okay, and then I'm going to come in closer. I'm going to scoot forward a bit. And I'm going to start looking at your head, your scalp, all right? So I like to start here at the hairline. And I'm looking for lesions. I'm looking for skin abnormalities, looking for patches of hair loss, any signs of infestation, around the ears here, around the other side. And I like to take a good feel over the entire head. I'm looking for any indentations, lumps and bumps that shouldn't be there, that the correct contours are there. Are you feeling any pain or tenderness as I'm feeling around your head? Not so much. Okay, that's good. All right, you just go ahead and note that down. Good. Now I want to test your cranial nerve number 7, the facial nerve, while I've got you here. We're going to do some funny facial expressions, okay? So I would like it if you could close your eyes real tight for me. Real tight, and open them up. Good. Now would you mind smiling real wide for me? Good. And if you could make a frown for me. And if you could puff out your cheeks. Like that. Great. Very good. Okay. So let me go ahead and do some palpation around your temporal artery right here. Okay, I'm just going to feel here, and I want to feel the strength of that artery, and that is working quite nicely. Okay. And now we're going to look into cranial nerve number 5 a bit. This is the trigeminal nerve. I'm going to be feeling around your masseter muscle here, and I'm going to have you clench your teeth for me. And I'm also going to feel around the temporal muscle up here. Okay? So I'm just going to put my hands right on the masseter muscle. If you wouldn't mind clenching your teeth for me. Keep them clenched. Okay, and I'm just going to work my way up. Temporal muscle, Keep your teeth clenched. Very good. And now I'm going to be having you try to open your mouth against my resistance, okay? So I'm going to be just pushing up underneath, okay? And if you could just try to open your mouth. Good, very good. We're going to go back to the temporomandibular joint here, okay? And if you wouldn't mind opening your mouth and closing your mouth, opening your mouth and closing your mouth. Good. That's good. Okay. Let's go ahead and feel around your sinuses. If you had any sort of pain or tenderness with your sinuses, or do you get any pain or tenderness if you bend down at all? Have you noticed? Okay. All right. So I'm just going to be pressing along your different sinuses along your face, and I want you to let me know if it's painful or tender. Okay. Just going to be pressing, press, 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 press. Okay? Press, 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 press. Good? Okay? Press, press, press. Press, press, press. Anything there? Not so much. That's good. I'm just going to tap along those areas a little bit, okay? Tap, 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 tap. Good. Tap, 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 tap. Still good. That's good. That's good. I don't know about you, but one of the things I absolutely cannot stand are sinus headaches. Sinus infections, whatnot, completely wipes me out. Good, 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 good. All right, so let's move on to your eyes, shall we? So I am going to look at your eyes. I might do a touch of palpation, okay? Be opening and closing your eyes. So, have you noticed any problems with your eyes lately? Whether it's a change in vision, itchiness, wateriness, change in color. Okay. Your eyes are quite clear. The sclera is a nice white color, which is good. It's not reddened or yellow like we may see in jaundice. Okay. Your pupils are the same size on both eyes. Now I'm just going to be pulling down on your eyelids, and I want you to look up for me, okay? I'm just going to pull down and look up. Good, good. The conjunctiva looks nice. And I'm just going to pull up. I want you to look down. Pulling up, look down. Good, good. That skin is nice and pink, not red, not quite pale, nice and pink. We're going to be testing cranial nerves number 3, 4, and 6 all which tend to govern eye movement, okay? So for that, I'm going to have you follow this light, all right? I'm going to sit back a bit so it's a little easier for us to get some range. Okay. Now I want you to follow this light without moving your head, just using your eyes. You could just follow the light for me. Follow the light. Good. Follow the light. I like to do the H formation. And then we'll take some diagonals. We want to guide you through the 6 cardinal directions of gaze. Okay, and we're gonna go up, down, side, side, up, down, side, side. Okay, and diagonally up, diagonally down, diagonally down, diagonally up, diagonally up, diagonally down, diagonally down, diagonally up. That's excellent. Very good. I don't see any signs of nystagmus, not seeing any delay or lid lag, so that's good. Now I am going to be doing the direct consensual response test with you. So I'm just going to dim the lights just a bit, if you don't mind. There we go. Just a touch. And I want you to look at the corner of the painting behind me. Good. That helps dilate your pupils. And I'm going to put my hand up between your eyes, and I'm going to be moving the light in to look at how both eyes react to the light. We're going to look for the direct response. Direct. Direct. Consensual. 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 Good. And the other side. Direct. 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 Okay. Consensual. 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 Very good. I'm going to just turn the lights back on. Excellent. And now let's test your accommodation reflex. I'm going to have you look at the corner of the painting behind me again. Good. And now if you could look at this light. Good. And can you follow this light as I go out and in, out, in, and out. Good. for the painting, the other side. And then look at this light. Okay, and we'll be going out, in, keep following the light, out, in, and out. Very good. Let me take a few notes. You can blink if you need to. Okay, now let's go ahead and take a little look at your ears. Have you had any problems recently, either with hearing or any pain, irritation, anything like that with your ears at all? No? Okay, very good. I'm going to get a little closer here. And I'm just going to start by taking a little look. Just looking at the ear. Okay, I'm just going to pull back your ear so I can look behind the ear. Behind the ear is often a hot spot for lesions. Like to make sure there's nothing lurking back there. And the other ear. Just taking a little look. And pulling the ear back. Seeing if there are any lesions. Okay, now I'm going to be doing a little bit of palpation on both ears. I like to start at the low, the bottom, and work up the helix to the top of the pinna here. I like to come down and around that arch and feel the fleshy bits inside, like the antitragus right here, and the concha, anticoncha, and then we come to the tragus right here. Okay, and I'm just gonna wiggle that around a bit. Feel any pain there? Okay. And I'm going to pull on your ears a bit and let me know if there's any pain or any tenderness. All good? Okay. I'm going to feel the mastoid process behind the ear. That's the bone right here, all the way down to the mastoid tip. Any pain or any tenderness in this area? Very good. All right, let's bring out the otoscope. So, my otoscope here has a little light, and I have a little speculum. Just pop right on there. And I'm going to be looking inside your ears. I'll be pulling the pinna up and back so that I can straighten out the ear canal and see much more clearly, okay? All right, so let's start with this ear, okay? I just flip on the light, just like that. And I'm gonna pull up and back on the ear. And then let's take a little look inside. Okay. So when we get into here, we're looking at the external auditory be a good amount of your growth. And then if we look back further, we get to the tympanic membrane. Tympanic membrane is a shiny little membrane. It is a pearly gray color. There is a bit of translucency so that we can see the tip of the malleus in the middle ear, or the inner ear rather. And we can see the cone of light bouncing back at us. Pull out the otoscope, put your ear back. Good. Let's do that on the other side. Pulling the ear up and back, and just gently inserting the otoscope. So again, we start with the ear canal. Is the skin the correct color? Are there any signs of swelling or irritation? Is there any signs of cerumen impaction? And then we get into the tympanic membrane. Are there any signs of perforation? Is it the correct color? Do I see the cone of light? Do I see the tip of the malleus? All these little bits that are important to check and double check when looking at the ears. And I'm just going to pull that out and put your ear back. Okay. Flip that off. Alright. So next I'm going to be doing a little hearing test. And this tests our cranial nerve number 8, the vestibulocochlear nerve. So what I'm going to be doing is just covering one ear and whispering into the other. I want you to repeat the words that I say, okay? Alright, so I'm going to go ahead and cover this ear. And I'm going to whisper in the other. Grapefruit. Kumquat. Cucumber. Starfruit. Watermelon. And what were those words? Very good. I'm going to cover the other ear and whisper in the other. Blueberry. Muskmelon. Strawberry. Raspberry. Orange. And what were those words? Yes, very good. You can tell I'm thinking about fruit. I love fruit. It really is a shame that it's not something I can have anymore. Okay, very good. Let's go ahead and take a look at the nose then, shall we? Have you had any problems with your sense of smell? Okay, and any runny nose, any dry, irritated nose? Have you had any problems breathing through your nose? No? Okay, so I am going to have you just look up for me a bit, or look back, I suppose, and I'm just going to take a little peek inside your nose, okay? Alright, so just going to look inside each nostril, looking for the health of the tissues, hair growth, the condition of the septum. I want to make sure there's no deviation, perforation, no irritation, swelling. Okay, and go ahead and put your head back to neutral. And we're going to do a little smell test. This would be cranial nerve number 1, the olfactory nerve. I'm going to have you close your eyes for me, okay? And I'm going to put something under your nose, and I want you to tell me what you smell, okay? Right. What does that smell like? Lemon. Very good. All right, and now I would like to have you breathe through each nostril by themselves. I'm going to just hold one side and I'll have you breathe. The other side, have you breathe, okay? I'm just going to occlude one side. If you could take a few breaths. Good, and let me occlude the other. Excellent. Okay. Very good. Let's take a little look at your mouth. So I start with inspecting the lips. I want to make sure that they aren't dry or chapped, that there aren't any cold sores, lesions, that they are colored more pinkish. I want to make sure there aren't any signs of blue lips or purpling lips, as that would be a sign of low oxygen, no cyanosis. So just taking a little peek. Would you mind opening your mouth? I'm going to look at the corners. Okay, very good. We're going to test your hypoglossal cranial nerve. We're going to do this by you sticking out your tongue. And can you move it to the left and the right, and up and down? Very good. Now if you could open your mouth, you can stick your tongue back in your mouth. We're going to get a tongue depressor, and I'm going to use my light. And we're going to look inside your mouth, okay? Have you had any issues with taste at all? No? Not generally taste if, you can smell things, as most of taste is smell, but you'd be surprised. So, have you keep your mouth open, and I'm just going to keep your tongue down. Very good. Okay, looking at soft and hard palate, and your throat, your tonsils. Would you mind saying ah for me? Good, good, good. Okay, now I'm going to have you just stick your tongue to the side, and I'm just going to push that. Okay, and the other side, I'm just going to push that. Good. And if you could lift your tongue to the roof of your mouth. Very good. Okay. And you can let your tongue rest. I'm just going to take a look at your teeth. Very good. That's lovely. Very good. Okay, so you can go ahead and close your mouth for a moment. Alright, so when we looked at your uvula, that tested your glossopharyngeal cranial nerve. And I'm going to flip this over, and we are going to do just a couple more tests. Now, this is going to be a touch uncomfortable, but I am going to elicit your gag reflex, okay? So I'm just going to do a quick little poke the back of your throat, and I know it's uncomfortable, but it is important, okay? You could open your mouth, right? And just a little poke. Yeah, not fun. Not fun at all. I know. And I'll just give you a moment. That one's kind of a hard one to recover from, I know. Okay, and I'm going to check your vagus nerve real quick. So I know that so far it looks good because you've been speaking with me without any hoarseness to your voice. But I'd just like to ask if you could swallow. Okay, and any difficulty with that? No, that's excellent. Lastly, we're going to be moving on to your neck. So I'm going to have you lift up your chin again for me, and that way I can look at your neck. That broadens out the neck, and I'm just going to look, okay? I'm looking that the trachea is in the midline. There doesn't appear to be any lumps or masses on the side of your neck, especially in the thyroid area. And you haven't had any problems with your throat, is that correct? No sore throats, no tightness, nothing like that? Very good. Okay. Now, real quick, go ahead and put your head back. We're going to check your accessory nerve. So if you could just turn your neck to one side, the other side, up, down. Good. Can you shrug your shoulders? Okay, and I'm going to put my hands on top of them. Can you shrug your shoulders against my resistance? Okay, very good. Now I'm going to do a little bit of palpation just to double check that the windpipe is in midline. I'm going to feel around the cartilage a bit and double check that there aren't any lumps, okay? So just give me a moment here. Just going to look. Right, and no pain or tenderness with this? No, not so much. Okay, very good. Alright, and I'm going to have you go ahead and recline back. So I'm going to manipulate the table here, and we're going to have you lay back a bit. Good. And I'm going to have you turn your head to one side. Doesn't really matter what side. I'm just going to be looking at the jugular venous pressure right in this area, okay? You go ahead and just lay there for a moment. Lay there for a moment. Just looking for I'll have you come back to sitting, and I'm just gonna put that down. Okay, very good. So we don't have to do the test for hepatojugular reflux, which is good. That one tends to be uncomfortable. So your jugular venous pressure looks normal. It looks like it is at a 2+ strength, which is good. And now I'm going to do a little palpation of your lymph nodes. Okay? All right. Just checking in real quick. Are you still doing all right? Very good. So let's go ahead and do your lymph nodes. So we're going to start with right in front of the ears. And we are feeling the pre-auricular lymph nodes. And then we move behind the ears to the post-auricular lymph nodes. And just behind the head to the occipital lymph nodes, generally about at the hairline for the most part. And then we bring it back to the parotid, right here by the ears. And we go down to the jugulo-digastric. Okay, and now we're going to be doing the submandibular and submental, right under the jaw here. Okay, and then we come down to the neck. So we have superficial cervical here. We have deep cervical chain here. Posterior cervical. And lastly, along your clavicle, we have the supraclavicular. Okay, very good. I'm just going to note that down, that everything there was good. No distension, no swelling. Okay. And we're going to do a couple of things to wrap it up. First, I'm going to palpate your carotid artery. Okay. Now, this can be a little bit uncomfortable. I just want you to be aware of that, okay? But I do one at a time. I'm not going to be doing both, right? So just one side here. Just going to be feeling that. And that is a strong, strong pulse, okay? And let's feel the other side. Good, okay. Lastly, I'm going to grab my stethoscope. And we're going to auscultate the carotid artery there. Now, I should be doing this with the bell of the stethoscope. Unfortunately, this one just has a diaphragm, but we can still take a listen. So, I'm just going to be putting this on the side of your neck, and I'm going to have you take a deep breath in and hold it while I listen for any bruits or audible heart murmurs, okay? So, I'm just going to press this to the side of your neck. Take a deep breath in and hold. And exhale. Good. And other side. Take a deep breath in and hold. And exhale. Good, good. Real simple, real easy. And I'm getting all caught with my hair. Long hair and stethoscopes often do not go hand in hand sometimes. Okay, that was quite satisfactory. Alright, and so ends our head and neck assessment. Do you have any questions for me? Any concerns at all? Okay, all good? Alright, well, this was a wonderful example of the pinnacle of health, so I have absolutely no worries for you. Just going to go ahead and sign off real quick. Very good. And send you on your way. Alright? Thank you so much for attending this head and neck assessment. I really appreciate it. I hope you have a whale of a day and a